BRCA mutations and how they relate to ovarian cancer. BRCA genes, or breast cancer susceptibility genes, are regulatory tumor suppressors responsible for the prevention of tumor growth in the human body. Mutations in BRCA1 or BRCA2 are often inherited and have been known to inhibit the repair of damaged cells. Because of this, BRCA mutations have been shown to have higher risks to several types of cancers. And by 70 years of age, 44% of women with BRCA1 will develop ovarian cancer. A study by Catherine Alsop aimed to look at how BRCA mutations impacted women with ovarian cancer, and the effects of specialized treatment for women with mutations. The study conducted was a Class 3 clinical trial with over 680 citations. It also had a high field impact rating of 13.4, which indicated the paper to be referenced 13 more times than average, and was also ranked as the top 1% of papers referenced in the field of medicine and genetics. Participants were recruited from the Australian Ovarian Cancer Study from 2002 to 2006. Women aged 18 to 80 who were diagnosed with epithelial ovarian, peritoneal, and fallopian tube cancer were recruited. The patients were then screened for BRCA mutations. The study involved 1,001 patients newly diagnosed with ovarian carcinoma, whereby 56% of patients self-reported a history of familial cancer. Through screening, it was found that 14% of patients had BRCA mutations, with 62% being BRCA1 and 38% being BRCA2. The procedure of the study involved 92% of patients undergoing up to 3 rounds of chemotherapy treatment with carboplatin and paclitaxel. Alternatives to non-platinum-based chemotherapy was also conducted for the remaining 8% of patients that were incompatible with the treatment. Results from the research found that women with mutated BRCA genes were diagnosed with ovarian cancer earlier, and that familial cancer history was a significant factor in the development of ovarian cancer in women with BRCA mutations. It was also found that women with BRCA mutations had an increased risk in developing visceral metastasis. BRCA mutations are also highly linked to high-grade serous carcinoma. It was also shown that given early intervention and individualized treatment, women with BRCA mutations responded better to chemotherapy and had increased survival outcomes compared to women without mutations. If there was one thing to take away from this video, is that genetic testing should be a more standard practice for patients with ovarian cancer. The study also showed that BRCA mutations were important to patient survival, and that genetic mutations, age, and familial cancer history were all important risk factors. However, statistics have shown that only 6.8% of ovarian cancer patients in Canada receive genetic testing after their diagnosis, highlighting the importance that genetic testing should be more standard in practice, as it has been proven to provide better approaches to treatment and therefore better survival outcomes.